Hepatitis B is more dangerous than HIV. Hepatitis B is more dangerous than HIV. Yes, I repeated it. Do you know why? Let's dive into it in today. Hepatitis B is a viral infection that affects the liver and can cause both acute and chronic liver disease. It is caused by hepatitis B virus, which is transmitted through contact with infectious body fluids such as blood, semen, or vaginal fluids of an infected person. Hepatitis B is a major global health problem with an estimation of 257 million people living with this chronic hepatitis B virus infection worldwide. So this infection majorly affects the vital organ of the body known as the liver. Then how can this infection be transmitted? This infection can be transmitted through unprotected sexual contact with an infected person or somebody that is a carrier. You have an intercourse with a person, you can be infected. Then the next one is sharing needles and syringes contaminated with HBV virus. So once you share any sharp object with someone that is infected, you are bound to contact it too. From an infected mother to her baby during childbirth. That's why careful measures are applied for women living with this at birth. Contact with an infected blood or bodily fluids through breaks in the skin or mucous membrane. If you have cuts on your skin or your eyes and there is a splash of infected fluid, you can contact it too. Then the next one is symptoms. How can you know the symptoms? Many people with this acute hepatitis B do not know. The one that is just starting, they won't know that they have it. When the symptoms do occur, they may include fatigue. You feel weak most of the time. You have jaundice, that is yellowing of the skin and the eyes. You have nausea and vomiting. You have abdominal pains. You have loss of appetite and even joint pain. Acute hepatitis B symptoms is typically appearing 1 to 4 months after the exposure. Assuming that you have been exposed to this hepatitis B virus, when you are expecting the symptoms to start is from at least 1 month to 4 months after the exposure to the virus. And these symptoms can last for at least several weeks. That is for the acute, the one that is starting suddenly, and the one that is just starting. So how do you tell you have this condition? The first one is hepatitis B infection is diagnosed through the blood test. There is a test known as hepatitis B screening test. It helps to detect the viral antigens and antibodies. So this test can determine if the person has acute or chronic hepatitis B infection, and they can assess the severity of the liver damage, because this infection, why it is dangerous to you is that it targets the vital organ of the body known as the liver and causes it to damage over time. So what are the complications? What will happen if you don't go to the hospital to find out whether you have this virus or not? The first thing it can lead to complications such as cirrhosis, that is scarring of the liver tissue, which can impair liver function and lead to liver failure. This is destruction, that is destruction of the liver cells, and this cannot be reversed. This condition cannot be reversed and therefore leads to liver failure. The next one it can lead to is liver cancer. Chronic hepatitis B infection significantly increases your risk of developing liver cancer. So if you have this hepatitis B virus and you are not treating it promptly, you can come down with liver cancer. Then the next one is fulminant hepatitis. This is a rare condition, a form of acute hepatitis B that is characterized by rapid liver failure, which can be life-threatening. This condition can be very, very life-threatening. Then, what are the prevention? How can you prevent yourself from coming down with this infection. The first one is by going for hepatitis B vaccine. It is highly effective in preventing hepatitis B infection and its complications. So this vaccine is typically administered as a series of 3 or 4 doses depending on the vaccine formulation. They give it 3 times or 4 times depending on the vaccine formulation. So, and before they give you this, you must go for the test. And once you are negative, the injection will start. Then, other preventive measures include practicing safe sex, avoiding sharing needles and personal items that may be contaminated with blood. Healthcare worker, you have to strictly adhere to these infection control practices. And as me as a healthcare worker, I have taken my own vaccine. Go get yours and take it, because this infection is very dangerous to health. Then how do you treat it? If it's the acute hepatitis B infection, that one is treated by relieving your symptoms. They relieve the symptoms that you are having, but in the chronic part, antiviral medications is given to you in order to suppress the growth and spread of this virus. So why this thing called hepatitis B is dangerous too? Because it does not have cure. This infection does not have cure. You have to be taking antiviral medications to suppress the symptoms. I've seen people that will come and say that they cured hepatitis B. It's a lie. It's the one of acute that you can just cure the symptoms easily like that and it goes. But the one of chronic, the one that have stayed over time, what you should do is to take your antiviral medications to suppress the virus. So always go for checkups to monitor your liver function and hepatitis B viral load if you have this infection. So it's important you go to the hospital regularly to check your liver and also know your viral load. The treatment is similar to that of HIV. So if this video has added value to you and you have watched this video to this extent, please like this video, follow this page, and also save for later and share to your loved one. See you in my next video. Thank you.